Did you know that prenatal stress and birth trauma are amongst the top reasons that babies struggle in their first few years of life? From colic to constipation, sleep struggles, torticollis plagiocephaly, tummy aches, leading into their older years of sensory struggles, ADHD, and anxiety, the list seems never ending. What we are seeing today in offices all over the country is that the paperwork always has one common denominator. Moms will say, I was so stressed out during pregnancy, or I had such a traumatic birth. I remember the doctor having to pull so hard to get the baby out. Other things that we've heard are, I lost a loved one while pregnant, or this is my rainbow baby after numerous miscarriages. Stress, stress, and more stress. So, how can we help ease this stress for both expecting mothers and their babies? Obviously, we can't control what happens in life, but we can help the nervous system be more able to work through and process this trauma easier so that both mom and baby will be more adaptable and resilient to all that life brings, hoping to possibly avoid some of the common symptoms that we mentioned earlier that we see with babies after birth. If you're an expecting mom or want kids in the future, keep watching this video as we will talk about how you can start influencing your child's nervous system even before they're born. So this video is for you expectant parents. You're planning to have babies in the future, families that want to have more babies, and anyone curious about how to have the best pregnancy and help learn more about the development of the baby's nervous system. We're diving deep into the health of mom's nervous system during pregnancy and how it can influence baby's nervous system development while in utero. You'll learn how the vagus nerve influences your baby's growth, while it matters for long-term health, and how you can support optimal development during pregnancy and beyond. Here at Generations Chiropractic, we specialize in cases that involve birth trauma and troubles during pregnancy. Sweet babies come in who struggle with colic, eczema, and sleep challenges. We also have toddlers and elementary age kids who suffer from these challenges as babies and then have to grow into diagnosis like sensory processing disorder, ADHD, OCD, ODD, and autism. As we mentioned earlier, in most of these cases, mom had mentioned fertility struggles, a stressful pregnancy, or a traumatic birth. These three things are very likely, especially with how medicalized our country has become with prenatal care, the common reason that all of those things start. So let's look at some of the stats to paint a full picture. America spends close to $100 billion on birth every year. 1 in 3 American women have a C-section, and the World Health Organization recommends that 10 to 15% at most, and deemed a true medical emergency. So we're almost double or triple what the average should be. 70 to 75% of American women receive an epidural, and 31% of women are induced. 1 out of 7 American women experience a postpartum mood and anxiety disorder. Fertility market in 2022 was $7.9 billion, and in 2028 is $16.8 billion. We've doubled that fertility market, which is so sad. 65% of women are on hormonal birth control. I'm so grateful for emergency medicine in the US. We are the #1 in the world for emergency care. But unfortunately for maternal and infant outcomes, we rank dead last at 55%. Again, not everything is in our control, but as a whole, something isn't quite right here. Medical intervention is definitely needed in true emergency circumstances, but not everyone should turn out to be an emergency pregnancy and birth. For low-risk pregnancies, too much interference is happening, leading to a cascade of events that we call the perfect storm, which are all those common symptoms and diagnoses that we are seeing time and time again in our office. So how can we best prepare our mind and our body for pregnancy and birth so that we can have the best outcome possible for both mom and baby? Let's go through 4 tips. Stick around because tip number 4 is going to be the most important. Tip number 1, empowerment and knowledge. Have you ever heard the saying that birth is 80% mental and 20% physical? When people told me this before having a baby, I never believed them. But after prepping for birth and studying for it, I had my dream birth. And that's when I did believe it. The 20% comes right at the end when you completely surrender your body and let it do what it was meant to do. When you are more educated, you know more, and you will do the best that you can. Tip number 2, start to prepare even before conception. This is for couples who know that they want to have a baby in the future or ones who are going through fertility struggles. There is so much that you can do to prepare your body. We call this preconception work. It's doing all that you can to be the healthiest version of yourself. If you attend a workshop, we go through into more detail on this, but at least 3 to 6 months before trying to conceive, start becoming the healthiest version of yourselves, both mom and dad. A big misconception is that prenatal life is all on the mom, but that isn't true at all. Dad has a big role to play, and mom and dad play that role equally, especially in preparing for conception and the fertility phase of it all. You are creating a baby that is half you and half your partner. Tip number 3, find your circle. This is so important. Surround yourself with people who protect your vision for birth. You want friends and family who are supportive of how you envision it all going. It's okay to build boundaries around yourself during this time and say that you don't really want to hear about their birth story if it isn't going to be in a positive light. Find providers also who align with your vision and answer your questions. You should never feel belittled or irrelevant. Your providers work for you. And number 4, the best one of all, nervous system health. The most important one is this. Make sure that your nervous system is adapted and resilient so that whatever life throws your way, you and your baby can process through it and not store that trauma within your bodies, but instead recognize it, process it, and adapt accordingly. Let's break it down. We start with the most basic understanding. The nervous system controls every cell, organ, and tissue of the moms and of baby too. A lot of the time, hormones get blamed for everything in pregnancy, from crying to mood swings to more serious topics such as fertility struggles and miscarriages. Doctors love to run to the chemistry imbalance of hormones. As this is true, is it really the root cause, or what system regulates hormones and decides which ones are needed at specific times? Your nervous system. There's our root cause. When the nervous system is dysregulated, many common symptoms occur. Things like cramps during your periods, increased symptoms from endometriosis and PCOS, fertility struggles, miscarriages, pregnancy pains, morning sickness and nausea, high blood pressure, constipation. Whatever the symptoms are, we can almost always trace it back to the nervous system. So how can you check if your nervous system is ready to make a baby, have a great pregnancy, and conquer birth and postpartum? The first step is to measure your heart rate variability. We do this at Generations Chiropractic using technology that is far more advanced than the Whoop, Garmin, and Apple Watches. And even your Oura Ring, I promise. We love those gadgets for daily use, but this will tell us overall how your nervous system is adapting to stress and if your body battery is ready to take on the prenatal season. This will also tell us how baby is adapting to stress as well, as whatever mom experiences, so will baby. So we need them to be adaptable too. We will also do 2 other scans that will tell us even more about your nervous system. Those 2 are also fast and non-invasive. They will tell us how your brain is communicating with the rest of your body, where you are storing and holding your energy, and how your nervous system is processing and dealing with stressors like trauma and toxins. The central nervous system is the biggest reproductive organ that we all have. It controls all of the other organs and hormones, so we need it to be functioning at its best for preconception, pregnancy, and well after birth and postpartum. If you want to see how your nervous system is functioning, DM us and get your neurological insight scans scheduled right away. That way, our doctors can read them, look over your history, and create a customized care plan for you and your baby. We have the opportunity to impact baby's nervous system even before birth, which is wild, and I'm so thankful for that. As we said, we aren't in control of many things, but when we can control how our system reacts to stress, we can have a better outcome and hopefully avoid the norm that is happening to so many kids today. For more information, visit the link in our bio, and you can check our website out for upcoming workshops based on birth and pregnancy. Our team can't wait to connect with you.